Which of the following is most likely pathology in the conduction system of this patient's heart? A 17-year-old girl suddenly grabs her chest and collapses to the ground while playing volleyball at school. Her teacher rushes her to evaluate the situation and finds the girl has no pulse and she is not breathing. So he starts chest compressions, and AED is brought to the scene, and within 3 minutes, a shock is delivered. The girl regains consciousness and regular sinus rhythm. She's rushed to the emergency department. Her blood pressure is 122/77, and her pulse is 65, and it's regular. And ECG shows shortened PR interval, wide QRS complex, a delta wave, and an inverted P wave. What is the pathology? So delta wave is a buzzword for Wolff-Parkinson's, right? And it should not have been mentioned there. You should be able to do this question without that, okay? So I will teach you Wolff-Parkinson's White separately once we're done with all the questions. Super high yield. And we should know the pathology behind it. What is the pathology behind the delta waves, Tapasvi? Yes. So there is an accessory pathway from the atria to the ventricle. Now, what happens in normal conduction? Normally, your conduction starts from the SA node, right? So the SA node will be, then it will send the transmission to the AV node, and then the AV node will transmit it to the rest of the heart via the Purkinje fibers and the bundle of his, right? But in Wolff-Parkinson's White, what happens is your AV node gets surpassed. All right. So there is an accessory pathway. Who knows the name of the pathway? It's Kent, bundle of Kent. All right. So it goes through the bundle of Kent. Now, because it is not going through the, if it goes through the AV node, then you have your normal QRS complex. Okay. That is your narrow QRS complex. If it goes through the accessory pathways, it's going to be widened. What does your QRS complex signify? It's ventricular depolarization, right? So you have your ventricular depolarization. So earlier it used to go via this long channel, right? Now it's not. So the start of the ventricular depolarization gets earlier. Now because the start gets earlier, so let's see. So this is your P wave. So this is your P wave. This is your QRS complex, and this is your T wave. All right. Now, what happens in ST segment in Wolff-Parkinson's White is because you're going through the accessory pathway. So your depolarization from when it goes through atria to the ventricle, it goes earlier. So this is what happens. Okay. So because it goes earlier to the ventricles, your ventricles depolarize earlier, right? And hence this is what is called as your delta wave. Now, because of delta wave, what will happen to the PR interval? Yes, PR interval shortens. And what will happen to the QRS complex? QRS complex widens, right? So it's normal physiology. And hence what is explained here. How is the wave described without saying a delta wave? They don't even have to say it's a delta wave. They will say an upsurge, okay? Or they won't even have to tell me where would you find a shortening of the PR interval and a widened QRS complex in a young patient. It would be Wolff-Parkinson's, right? Because it is signifying an early ventricular depolarization. You have an accessory pathway. So this is the normal conduction. It starts from SA node, AV node, bundle of His, and Purkinje fibers. But in Wolff-Parkinson's White, you are not following this normal. You have actually formed accessory pathway. So it goes earlier and it depolarizes the ventricles earlier than expected. And hence you're going to get this delta wave, right? So this upstroke leads to decrease in the PR and increase in the QRS. Now, where do you see option C, wandering atrial pacemaker? So the most common risk factors for hypertrophic cardiomyopathy are two. One is hypertension and the other one is aortic stenosis. Okay, so in young patients, if you have bicuspid aortic valve, it is actually a predisposing factor to developing aortic stenosis. So that can also be a risk factor. So my question, people, stop asking me questions when I'm asking you. I know that's a trick. Where do you see a wandering atrial pacemaker? What type of arrhythmias? Quickly. It's multifocal atrial tachycardia. It's not very high yield for step 1. It was asked in step 2. The ECG of multifocal atrial tachycardia. But for step 1, I don't think you need to do it. So for multifocal atrial tachycardia, if you need to know one thing about it, know that in one ECG, you will have 3 different morphologies of P waves. That's like the super important thing about multifocal atrial tachycardia, okay? You usually see it with COPD. So a patient with COPD, if you see their EKG, you're seeing 3 different waveforms. P wave, that's multifocal atrial tachycardia. 3 different morphologies, okay? And then we have heart blocks. So in the heart blocks, you have 3 different types: type 1, type 2, type 3. The first degree heart block is just prolonged PR interval. Your normal PR interval is less than 200. What is the normal QRS interval after which you say it is wide? So you need to know this. Normal QRS interval. In first degree, the patients will be completely asymptomatic. You do not need to treat them, right? You'll just be monitoring them more frequently, and it's only going to present as increased PR interval and nothing else, right? Your second degree has 2 types. Your second degree has Mobitz type 1 and Mobitz type 2. Okay. Now, what will happen in Mobitz type 1? Mobitz type 1, you will have a progressive increase in the PR interval, right? And then after some time, the QRS complex will be dropped. Okay. So there is like a P wave and a QRS. There is progressive increase between the two, and ultimately, one P wave will not be followed by a QRS complex. That is your Mobitz type 1. What about Mobitz type 2? The type 2, the interval is fixed, so you don't have progressive increase in the PR interval, but you still have a B drop. The impulse generation by tissue in AV node. What is this B? What is the arrhythmia that you see in option B? So this is your junctional rhythm, okay? So AV nodal tachycardia, AVRT.
Thanks for watching. Please give a thumbs up and subscribe for more.